wherever, your car for 20 minutes and we don't see you, that's time card fraud. If you clock in the first floor and you really work on the fourth floor, that's time card fraud. More people leave the organization for time card fraud than for any other reason. Don't do it. So we're very serious about that, but I know nobody in this room is going to have a problem with that. Number 3 and number 4, gross negligence. Right? Number 3 is gross negligence. Number 4 is unsatisfactory work performance. And they're very similar. A gross negligence is a little different. Unsatisfactory work performance is you're trying, but you're just not quite a match for the job. You just can't really do the job. Whereas gross negligence means, yes, you can, you've been trained, and you know how to do it, but you're just not paying attention to what you're doing. You're not focused, you're leaving the sharps out, you're not doing what you're supposed to be doing, and you're creating issues, and it happens more than once. We need to look at that as a performance issue. Does that make sense? Anybody can make a mistake once, right? And we want to create a culture where you can feel comfortable in speaking up about those things. But if we see a pattern, where it looks like you are just not paying attention to what you're doing, or acting like you don't care, serious, serious problem. Number 5, insubordination. And do me a favor, Danielle, could you close the door for us now? Thank you. Because I'm going to lay some heavy stuff on you right now, and I want that. No, I'm just kidding. So insubordination, you have a supervisor, everybody has a boss, you have a manager, and your manager asks you, tells you to do something. Now we know that managers are fallible, right? We're human beings, make mistakes. So not everything they tell you is going to be perfect, right? Nevertheless, when it's go time, we have to follow what the supervisor says, right? Now we also have a labor management partnership, so that means that there should be a time later on to find out, to really speak up about that and find out if that was the best call, or maybe plan for a better way of doing things the next time. But right, when it's showtime, we have to go, and there has to be somebody who's making that call. Therefore, you should accept a supervisor's direction. And we're going to talk about some exceptions in just a moment. So if you feel, for example, that your supervisor is telling you something you just don't think is fair, I'm using that word, it's not fair, right? You're playing favorites, it's not fair. Eden's over there, he's not doing anything, how come you're asking me? And it has been known to happen. But more often than not, there's other things going on that you can't possibly always be aware of. But if you feel strongly about it, we do want you to feel that you can address it later on, have a conversation, or after a period of time, right, after you pass your 90 days, you bring your union steward if you need to do that. Okay, so hopefully none of this stuff is going to come up. But there's actually 3 exceptions. When your manager tells you to do something, if your manager, number 1, tells you to do something illegal or which violates patient privacy, you should not do that. You need to escalate that immediately. Make sense? If you are asked to do something that violates your scope of practice, you're an LVN and you're being asked to do something that you're pretty quite sure is part of the RN scope, you need to find a way to escalate that quickly. If you are asked to do something that is unsafe, that would put yourself or others at harm, for example, if you have not been trained on a particular piece of equipment, right? We actually had a situation where a young employee, there was a situation she was asked to operate a defibrillator machine on a crash cart. She did not know how. She should have spoken up. Instead, when the thing was turned on, her hands were on the grounding plates. She got badly burned. We don't want to see that happen. It would have been 100% okay and encouraged to say, just need to tell you, I haven't been trained on this piece of equipment, so I don't want to put you or myself or anybody else at risk. Does that make sense? Other than that, if you just don't think it's fair because Eden's sitting there and he's not doing his job, then please follow your supervisor's direction.